My name is Mark Smith. I'm the National Federation of Federal Employees Local 1 President, representing healthcare workers here at the Veterans Healthcare Administration. And we're out here, protesting the proposed cuts to the Veterans Healthcare and Benefits. The Secretary and the Trump administration have announced a proposal to cut 80,000 jobs at the VA. And so we are out here trying to raise awareness and let them know that that's a bad idea. These cuts have already been impacting us here at the VA and CARE. They cut probationary workers originally, and the Secretary and others are saying that those roles were not critical, but we know that many of those roles were critical. So just to give an example, they were cutting our police dispatcher was a worker who got cut, and that's a critical role. They dispatch obviously police. On the campus, keep our nurses safe, things like that. But also, they help to, coordinate with local police, do welfare checks of our patients if they're having medical issues, things like that. So just, things like that cause chaos and are just harmful to CARE.
And they're happening around the country. Are these kind of protests going on nationally?
Yeah, I would say that rallies like this, pickets, informational pickets, are happening around the country. We have one happening at the Santa Rosa Clinic up north, which is one of our clinics here at the healthcare system. But I've seen rallies at the San Diego VA, at the Asheville, North Carolina VA, at every VA, not every VA, but many VA clinics. Rallies like this are happening. Veterans are standing up. Healthcare workers are standing up. The public is standing up. No cuts to veterans care. No cuts to our services. That
June 7th.
So June 6th. June 6th, there is a march on Washington. The Unite for Vets Coalition, uniteforvets.org. Veterans are going to Washington to, fight for the benefits and healthcare that they've earned, as well as the jobs, right? Many of the folks who are being fired right now, illegally terminated across the federal government, are veterans themselves. They have served their country honorably and then, returned to good federal jobs where they're taking care of their fellow veterans or the public and, having these good union jobs, and they're being cut from their jobs, right? And not for good reasons in many cases, right? For some of those folks, they were probationary because they were promoted to a new job, right? Because they were high-performing, high-quality workers, were promoted to a new job, and then because of that promotion, were probationary and, were let go for, all kinds of unknown reasons. So
there's a growing anger and frustration in the VA among workers and among the patients that their future is threatened by these cuts.
Yeah, I would say anytime you propose massive cuts to public services that millions of Americans rely on every day, whether it's veterans health care, whether it's Medicaid or Medicare or SNAP benefits, all these things that are being proposed in the current budget, which, cuts social services, healthcare, and other spending to pay for tax cuts for billionaires. Anytime that happens, you're going to have people, working folks, people who rely on these services, disabled folks, are going to be angry and upset. And I think that's what you're seeing across the country.
And FAN, it's bringing together workers from different unions around the country?
The Federal Unionist Network, which you can go to federalunionist.net, is bringing together rank and file union members across unions and federal workers all across the federal government, coming together to say, no cuts, save our services. We want to take care of the American public, and we just want to be able to do that without interference, without chaos, and without disruption to the services that we provide to the American public, whether that's VA healthcare and benefits, whether that's Social Security, whether that's Medicaid, Medicare, SNAP benefits, farm services, right? If you're at the USDA, all of these things, we want to continue to provide services for the American public. That's what we took the oath to do, and that's what we are going to continue to do.